Today, we approach a topic that impacts millions of individuals globally: chronic fatigue syndrome, or CFS, also known as myalgic encephalomyelitis, or ME. This condition can be incredibly debilitating, yet understanding it can empower those affected. So let's explore what CFS is, how it can impact daily life, and what management strategies may help. Chronic fatigue syndrome is a complex and debilitating condition characterized by extreme fatigue that lasts 6 months or longer and doesn't improve with rest. The fatigue can be so profound that it severely disrupts a person's ability to perform every day. It's a medical condition of still unknown cause, with fever, aching, and prolonged tiredness and depression, very often occurring after a viral infection. Alongside fatigue, individuals experience a range of other symptoms, such as joint pain, muscle weakness, and cognitive difficulties like memory issues or difficulty concentrating, often referred to as brain fog. 70 to 80% of those diagnosed with CFS are women, meaning that the male-to-female ratio can be 1:3 to 1:4. Now, you might be wondering, what causes CFS? The onset of CFS is believed to result from a combination of individual predispositions, genetic factors, environmental triggers, and immune responses. Research is ongoing to better understand the relationship between viral infections and CFS, and while the exact causes are still unclear, researchers have identified several potential contributing factors. Let's break them down. Viral infections, like Epstein-Barr virus. Immune system dysfunction. Hormonal imbalances. Metabolic disorders like diabetes. Psychological or emotional stress. Environmental issues, such as exposure to toxins or emotional trauma. Medical evidence suggests that chronic fatigue can follow a viral illness, and ongoing research is exploring the role of genetics in susceptibility to chronic fatigue. Diagnosing chronic fatigue syndrome can be quite challenging as there are no definitive lab tests for it, so doctors typically rely on a comprehensive evaluation. This evaluation includes a detailed medical history, a physical exam, and ruling out other medical conditions that might explain the fatigue. It often involves various assessments, including blood tests, sleep studies, and psychological evaluations to get a complete understanding of the patient's health. To diagnose chronic fatigue, doctors look for characteristic symptoms, including post-exertional malaise, when symptoms get worse after physical or mental exertion, unrefreshing sleep, cognitive impairments, difficulty concentrating or processing information, significant fatigue after minimal exertion. Now that we understand the basics of chronic fatigue, let's talk about some lifestyle factors to consider before exploring nutritional supplements to boost the immune system. Consider conditions like iron deficiency anemia, which can affect overall energy levels. Check our video on anemia. For example, low iron levels can lead to fatigue, and the use of antacids can inhibit the absorption of essential nutrients like B vitamins and iron. People experiencing fatigue rely on multiple alarms and caffeine just to get out of bed. They often deal with low blood pressure, low blood sugar, high stress, and dependency on stimulants. Salivary cortisol tests show that ideal cortisol levels in the morning should be high, but fatigued patients often fall short. Cortisol is a steroid hormone produced by the adrenal glands, which sit atop the kidneys. It plays a crucial role in various physiological processes in the body. Here's how cortisol works. 1. Regulation of metabolism. Cortisol helps in the metabolism of carbohydrates, fats, and proteins. It increases blood glucose levels by promoting gluconeogenesis, the production of glucose from non-carbohydrate sources, in the liver, and stimulates the breakdown of fat, lipolysis, and protein, proteolysis, for energy. 2. Response to stress. Cortisol is often referred to as the stress hormone because its levels increase in response to physical and psychological stressors. It prepares the body to respond to a fight-or-flight situation, increasing energy availability and suppressing non-essential bodily functions during emergencies. 3. Immune function regulation. Cortisol has anti-inflammatory effects. It can inhibit the production of substances that trigger inflammation and immune responses. This is why corticosteroids, synthetic versions of cortisol, are often used to treat inflammatory conditions. 4. Blood pressure regulation. Cortisol helps maintain blood pressure by various mechanisms, including modulation of certain hormones that constrict blood vessels and by regulating the balance of salt and water in the body. 5. Circadian rhythm. Cortisol levels oscillate throughout the day, peaking in the early morning and gradually declining throughout the day. This rhythm is linked to the body's sleep-wake cycle and influences energy levels and alertness. 6. Influence on mood and behavior. Elevated cortisol levels, especially over prolonged periods, can affect mood, leading to issues such as anxiety and depression. Chronic stress causes prolonged high cortisol levels, which can have negative effects on mental health. 7. Feedback mechanism. Cortisol operates within a feedback system involving the hypothalamus and pituitary gland, known as the HPA axis. When cortisol levels are sufficient, they signal the hypothalamus and pituitary gland to reduce the production of corticotropin-releasing hormone, CRH, and adrenocorticotropic hormone, ACTH, which in turn lowers cortisol production. Cortisol is vital for managing stress, regulating metabolism, maintaining blood pressure, and influencing immune functions. However, chronic elevated levels due to prolonged stress can lead to various health issues. Chronic fatigue patients might benefit from increasing cortisol levels, but it is important to approach this carefully, as chronic elevation of cortisol can lead to negative health effects. Here are some positively healthy suggestions for increasing cortisol. 1. Physical activity. Engaging in moderate to intense exercise can stimulate the release of cortisol. 2. Stress management. While stress can lead to chronic increased cortisol levels, certain forms of stress, like acute stress, can result in a temporary boost in cortisol. Engaging in challenge-based tasks can elicit a brief increase in cortisol. 3. Diet. Some foods can influence cortisol production. For example, protein-rich foods. Consuming protein can trigger cortisol elevation as the body works to metabolize it. Caffeine. Moderate caffeine intake, found in coffee and tea, can stimulate cortisol release temporarily. 4. Prioritize sleep. While sleep deprivation can lead to chronically elevated cortisol, improving sleep quality and duration helps regulate cortisol levels. A good sleep routine balances hormone levels. 5. Cold exposure. Exposure to cold temperatures, such as cold showers or ice baths, can induce a temporary increase in cortisol levels due to the stress response. 6. Healthy lifestyle choices. Maintaining a balanced diet, staying hydrated, and practicing stress reduction techniques such as mindfulness, yoga, or meditation can help optimize cortisol levels without leading to chronic elevation. 7. Supplementation, with caution. Some supplements, such as adaptogens, ashwagandha, rhodiola, are thought to help the body adapt to stress and may influence cortisol production. However, the effects can vary, and supplements should be taken under professional guidance. While some of the methods above can temporarily elevate cortisol levels, it's crucial to maintain a balanced approach. Chronic high cortisol can lead to various health problems, including anxiety, weight gain, and immune dysfunction. If you have concerns about cortisol levels, whether too high or too low, advise with your healthcare professional. And for those looking to improve sleep quality, especially in cases of chronic fatigue, here are 5 recommended supplements. 1. Magnesium, threonate or malate. 300 to 500 milligrams before bed could promote calmness and relaxation. 2. Methylcobalamin, B12. 1 to 2 milligrams taken in the morning can help regulate melatonin production. 3. Passion flower, a soothing herb that can reduce anxiety and enhance sleep quality, especially in tea form. 4. CBD. 25 to 50 milligrams before bed might help lower cortisol and anxiety levels, improving sleep quality. 5. Valerian root. 100-300 milligrams before bed is known for its effectiveness in improving restfulness and overall sleep quality. 6. Use adaptogenic herbs like ashwagandha and holy basil to help balance cortisol. It's always best to start with the lowest effective dose for each of these supplements and gradually increase based on your body's response. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health tips and discussions. Managing chronic fatigue syndrome can be a complex journey, but understanding your body and what it needs can make a significant difference.